This video will be about global impacts and misunderstandings of autism spectrum disorder. And before we get into that, I just want to give a little self-introduction. My name is Ava Schombacher. I go to Lock Haven University and I am majoring in psychology with a minor in political science. And why I chose this topic is because right now there are more cases of diagnosed autism now than ever. And this is a hugely globally misunderstood disorder. And I really just want to spread awareness about autism and explain the misunderstandings of it. So first, what is autism spectrum disorder? So looking at the DSM-5 definition, which is the Diagnostic and Statistical Manual of Mental Disorders, which is just a reference book published by the American Psychiatric Association that provides criteria for diagnosing mental disorders. So for autism, they say that it's a complex neurodevelopmental condition characterized by persistent deficits in social communication and social interaction, as well as restricted repetitive patterns of behavior. And that can be a little confusing to understand, so I also gave a simplified definition, which is just a developmental disorder that affects how individuals interact and with people, learn, communicate, and behave. So first, we're going to talk about the 3 different levels of autism. So first, we're going to be speaking about level 1, which requires support. And this includes difficulty initiating interaction with others, struggle with organization and planning, and some emotional dysregulation, and can often function independently. And on the side, I have a little graph with some more symptoms, which are sensory sensitivities, which is just being overwhelmed by loud noises or certain textures, routineness, which is preference for routines, and distress when disrupted, interest, which is a tendency to talk at length about specific interests, communication, which they have trouble understanding social cues, and social interaction, which is just difficulty starting or maintaining conversations. Next, we'll be talking about level 2 of autism, which requires substantial rapport, which includes social interactions, have little verbal communication, mild, restrictive, and repetitive behavior, high interest in specific topics, and people with level 2 autism need more assistance in daily activities. And on the side in this graph, I have some ideas that can help people with level 2 autism, and these include the Behavior Intervention Plans, or BIP, which is addressing challenging behaviors before they escalate. Next is reinforcement, which is encouraging positive behavior with rewards. Third is natural environment teaching, or NET, which is practicing skills in real-life settings. Next is discrete trial training, or DTT, which is breaking skills into smaller steps. And lastly is ABA therapy, which is the gold standard for autism treatment. And the last level of autism is level 3, which means requiring very substantial rapport. And with that, there is a severe lack of social communication skills, both verbal and nonverbal, difficulty dealing with change, intense repetitive behavior, and needing significant support in many to all areas of life. And on the side, I have some other symptoms, which include motor difficulties, communication difficulties, repetitive behavior, sensitivity to change and stimulation, and social impediments. Next, we will be discussing the increase in diagnosis of autism spectrum disorder. So if we look at from 1970 to 2025, we can see there is a huge increase of diagnosis. So in 1970, 4 in 10,000 children were diagnosed, and looking at 2025, we see that 1 in 31 children were diagnosed. And these low rates of diagnosis were due to a lack of information, limited awareness, and limited understanding. But now that we have more of an understanding, many cases that were misdiagnosed led to an underreporting of autism cases. But now with more understanding, they're able to be reported, and that's why the numbers have been raised so high. And in the graph of through the years, the autism prevalence rate, we can see just from 2000 to 2020 how much it has risen. In 2000, starting with 1 in 150 children being diagnosed, to 2020, 1 in 36, and now looking at 2025, 1 in 31. So now we see that more kids are being able to be diagnosed. Next, we are going to talk about the factors of the increase more in depth. So the first factor of increase is improved awareness, and this significant increase in both public and professional awareness, and this has helped more children be screened and diagnosed. Next is changes in the diagnostic criteria, and this criteria for diagnosing autism has evolved, allowing more individuals to receive an accurate diagnosis. Next is better screening practices, and these improved screening tools, along with early detection initiatives, have contributed to diagnosing more children with autism at younger ages. And lastly is research and data collection. And this data collection by multiple organizations has improved the accuracy of autism estimates in the world. And on the side, I also have a little diagram of reasons why autism appears to be increasing. And these say the increased understanding of autistic experiences, changes in the diagnostic criteria, viewing autism as a spectrum, which I did talk about, understanding that anyone of any gender, age, and race can be autistic, an acknowledgement that autistic people can mask, reduce stigma, can encourage more people to seek a diagnosis, and recognizing people can have coexisting conditions. Next, we'll be talking about the key misunderstandings of the autism spectrum disorder. First is that autism is a mental illness. Lots of people will mistake autism as a mental health disorder, but it's actually a neurodevelopmental condition. Next, that autism is caused by vaccines or medicines. Extensive research has debunked this myth, and autism has no link to vaccinations or medicines taken by mothers while pregnant, like acetaminophen. Next, that autism can be cured. Autism is a lifelong condition. More focus should be on the acceptance and understanding rather than a cure, because autism cannot be cured. Next is that people with autism cannot form relationships. Social interactions can be challenging for people with autism, but this doesn't mean they aren't capable of forming relationships and meaningful connections. Next is the high functioning versus low functioning, which is a term that people will use for people with level 1 compared to level 2 or 3 autism. And these terms oversimplify the spectrum. People labeled as high functioning may still face challenges that aren't visible, which leads to misunderstandings about their needs as well. And lastly is intellectual abilities. Everyone with autism has intellectual abilities, and this is just not true. Many people with autism show a variety of intellectual abilities. Some may have intellectual disabilities, of course, and others may have academic and professional abilities. So it's not that everyone has intellectual abilities and disabilities. It just varies within the person. And on the side in the little graph, it just shows that neurological basis, autism is rooted in brain differences, and there's a potential for growth. Individuals with autism can achieve goals and spectrum of abilities. Autism presents itself differently in each person. And lastly, we'll be talking about the steps to understanding autism spectrum disorder to help anyone be able to understand people with this disorder better instead of assuming things or misunderstanding their needs. So first is to educate yourself about autism and understand the spectrum and learn about the diagnosis process. Learning can help you understand more about people with autism, like their communication styles and behaviors. And along with this, understanding the spectrum can help you recognize that symptoms and their severity can vary, And with that, learning about the diagnosis process can help you gain knowledge about how to support individuals with autism. Next, ask questions. Asking questions can help you avoid any misunderstandings you have right off the bat. And clear communication is super important. Using direct language and avoiding indirect communication will reduce misunderstandings. And setting boundaries and clearly communicating these boundaries is important to avoid assumptions about autism spectrum disorder. And lastly, explore early signs.